From day to night.
How are vital signs?
The most critical injuries are sent to Brackenridge's ER. It's the only trauma center in Central Texas, which means people from at least 11 counties depend on it.
1, 2, 3.
But doctors say providing the most advanced life-saving care is threatened because increasingly they're taking care of the uninsured. It's the only place they have a legal right to care regardless of their ability to pay.
I'm basically going to a coma, and other people would get me to the emergency room.
39-year-old Dee Dee Dodd would go into a coma because she couldn't treat her diabetes. She couldn't afford to.
It was hard. It was up to the point to where I was giving up.
Dee Dee found herself in the emergency room and hospital several times. In fact, in the last 2 years, her bills added up to more than $190,000.
They're like, you won't pay this? And I'm like, it's not that I won't pay it, I can't.
Dee Dee is just one person who couldn't pay. Last year, Brackenridge and Children's Hospital emergency rooms racked up more than $100 million in unpaid charges.
As that share of money that's available, that's small, goes more and more to the uninsured, eventually it is going to impact hospitals' ability to stay at the forefront of medicine, providing the best equipment that physicians need. And did you have a clinic? Did you try and make an appointment in a clinic?
It's almost impossible to get in on the line to get an appointment. I've been trying for weeks.
Day after day, the uninsured turn to the ER. Many of them say they try to get appointments at local community clinics set up to serve them, but they're full.
It was $92.45 for today.
We know there's a healthcare crisis, and that's hard for all of us, and I think it's very challenging for our front desk staff. They're on that front line of people calling in all the time with their stories, and we're just full and they can't get in.
Patients we talk to who do get into community clinics say they get good basic care. But if they need specialty care, certain diagnostic tests or surgery, they are often sent right back to the ER.
Sometimes we do have to use the ER as our backup, and that's always we agonize, okay, do I send them to the ER so they get what they need, even though it's a huge expense?
Buenas tardes.
The uninsured are the most common patients at Brackenridge's emergency room, and experts predict if action isn't taken soon, the numbers will rise.
But it affects all of us as well, even if we think it doesn't, because the large number of uninsured drive up the cost of health care.
This is what health experts say is happening. In an effort to cover some costs, the person who does have health insurance pays an inflated ER bill. Their premiums go up, making their health insurance unaffordable to them or their employer, adding to the number of uninsured. In an attempt to slow that vicious cycle and reduce costs, Brackenridge is flagging some of the most expensive repeat ER patients and giving them free primary care. The idea, keep the highest risk patients healthy so they don't end up in the ER with astronomical bills. Dee Dee Dodd recently became a part of that small group.
It was great because I saw hope again. I didn't want to just give up. I saw a reason to fight again.
For Dee Dee, getting primary health care gives her reason to live. But the program she's in only reaches about 200 people a year, leaving thousands of uninsured Central Texans with no other option but the emergency room.
Across the country, you're seeing a number of emergency departments continue to close because it is financially so difficult to operate an emergency department. The emergency departments are truly strained.
And doctors say the strain on Central Texas's only trauma center could one day affect getting the best care in the most critical moments. Seema, Mathur, CBS 14.